Good morning, and how is everybody out there? Today and from today we're going to start our Your Health Today program with Dr. Soliman at 9 o'clock of every Saturday. So welcome, and we're going to start today with something that is very interesting. I will share with you a case about a small child that when you see the child before we have started treatment, you will really feel very sympathetic towards that child. If we can play the images, then we'll show you how the child looked like when she came to the hospital. As you can see, this is the hand, and the hand is very thick. The skin on the hand is very thick. And you can see also here, very thick skin, like the girl is about 100 years old or so. That is the skin of a 12-year-old. That is the skin. Look at the neck, and look at the hyperkeratosis, look at the folds of the neck. Very bad, very thick skin, and very foldy and very black. And if you touch it with your hand, look at the forehead, focus on the forehead, and you see the folds of the skin. You see the folds. The skin is folding as if she is a very aged woman. The skin is very bad. Look here, the same thing. The skin is very thick and very aging. The skin is like 100 years old, and now this is severe fungal infection that has been extended to this poor girl from her feet all the way to the head. Look at the forehead. Look at the folds of the forehead. And you can never, if you cover the face and only show the forehead, you will definitely say that this is a patient that is above 60, 70 years old. So the skin was very bad. The skin was very bad. This is how she came in. So she came in, the skin is extremely thick and hyperkeratosis, meaning very dark black spots, especially at the area of the elbows and the joints where she can look at the arm. This is the area where she flex and extend at the level of the elbow. Look how black it is, and look at the folds. This is hyperkeratosis in a 12-year-old. And this, she has been suffering this almost since very young age. Been everywhere, done everything, nothing, no resolve. She came, she stayed with me for about a week. I mean, in and out. She come and take the treatment and go. Now, what is this case? What is this case? What can happen? What can cause this child to manifest like that? That is extensive fungal disease. Extensive fungal disease. Usually, when we get any fungal infection, our immune system, yeah, that's good, is enough. Our immune system can fight it. But sometimes when we are missing a component or two in the immune system, our immune system can no longer fight a fair fight whereby we can get rid of those fungal infections. That's one reason. Especially if this scenario exists since birth. Second possibility is she had the fungal infection, but she has never taken the correct treatment. So the fungal continue to grow till it includes everything in her body. Now this is devastating, especially for a child like this that goes to school. I mean, you can imagine that, you know, she is not very happy because about the way she looks. She's not, you know, among her friends and in classroom and all. It's not very nice to have such a skin and such looks you will be bullied from here till next year. I mean, and the girl felt really bad. So we're talking about not only physical appearance that is distorted, but we're also talking about emotional damage to that little girl because of the way she looks. She came in, and now I want to show you, after 1 week or so, 1 week, 10 days of therapy, I want to show you the new skin. How does it look now? How does she look now? Now, the skin is clearing up. Look at the neck. Is no different. Look at the forehead. All those folds at the level of the forehead are already gone. Is no more there. Look at the forehead, how shiny it is. You see the forehead, how wrinkled it was before the treatment? And look at the forehead, how shiny it is, and no more folds, no more wrinkled. The girl looked like a 12-year-old, not like before. Look, even the smile to her face. So her new look now, brought her a smile, and this is what she was missing. She's a child. She needs to feel good about herself. The family wouldn't believe even the transition that she has gone through from a very aged looking skin, very thick skin, very infected skin, to the new look. Everything has cleared. In a matter of less than 2 weeks, everything has cleared. Focus on the forehead, and you see there is no more folds. There is no more wrinkles on the forehead, and that is amazing. That is amazing. So all we had to do is identify the microbe and then have the correct medication for the microbe. We infuse her with some medication to make the skin brighter, looking better, and remove all those antioxidants. When the skin gets wrinkled like that and the aging spots appear on a small girl like that, we have a lot of toxins. So the best thing to do in this case, beside killing the microbe, is to give an antioxidant treatment. This is before and this is after. Thank you very much, Johnson. I appreciate that. I was exactly looking for that. Now this is a picture. Put this side to side. You see, look at the forehead before the treatment, how wrinkles it is. Look at the aging of that girl, and look now, about 2 weeks later, after treatment, look at the forehead, what it looked like now. You see the big difference. You see, it's totally amazing how we can transform a patient like that with all those folds, with all this infection, with all this hyperkeratosis, which is the thickened skin around everywhere, to now. That is totally amazing because the girl, not only that the girl is relieved from the sickness, but the girl had a smile on her face now. She can go to school. She no longer can be bullied because she complained too much. Doc, I don't want to go to school anymore because the way I look. The family took her everywhere possible. No avail. Nothing can happen. Nothing can solve her problem. Now we can see together, all of us, that this is a really a miraculous transition from where she was to what she is right now in less than 2 weeks' time. With the correct medication, correct diagnosis, correct medication, everything can, above all, of course, the help of God, everything can happen. So this is a good story that I like to share with you before we start our session today about different things. So the disease was fungus, namely tinea, among others. So when we use the same medication over and over, here they use fluconazole, they use ketoconazole, they use this kind of drugs. Over years and years and years of using the same drug, the microbe is resistant. It doesn't work anymore, plus the side effects. So it has to be time then for a new medication that the microbe doesn't know and cannot fight it, because every time you use the same medication over and over, the microbe develop resistance, meaning you give the old medication that you always give, the microbe will take it, eat it, and thank you, doc, for giving me the medication. But now we have to think, what can be done to give this patient a medication that the microbe is susceptible to, is no longer resistant to? So we have to give a medication that is, meet, meet our goal, that killing the microbe with the least possible side effect, because you cannot, normally with fungal infection, you have to give the medication for a very long time. And if you give fluconazole, ketoconazole, or any of those ordinary drugs for a long time, the patient will suffer a lot of side effects that we do not want. So we have to think about a way to get this patient medication. Actually, I give her IV, some few medication, and look at the transition. Amazingly transition from a very sad girl to a very happy girl, and the skin folds now has cleared. The aged skin, hyperkeratosis skin, dark skin, especially around the neck and around all the skin folds like the elbows and the legs and the knees, everything has cleared up, and the girl is very happy. Still, I'm not saying that is 100%, but at least we changed the looks. We thank God for that. We changed the looks, and she has to continue on skin hydration, and we have to also be on the lookout for anything that might attack again. So this is a happy case that we have solved very successfully, and we thank God for that. So I want to take 1 minute, just 1 minute break if it's possible, and then we'll continue on the next topic.
Facing challenges in your health? Then Dr. Soliman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Soliman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Soliman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at mile 18 Bulifamba, and in Douala, we are located at Entre Pilor. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Soliman.
Welcome back. Now today I'm gonna share another story with you, but I don't have images because that was, I totally forgot to take images. But anyhow, the story is also another young boy. This time is a boy, about 11 years old. And this young boy been from one place to another, from one hospital to another. They are coming from far, Quantititi, I think, or in the southwest, but far. They don't have, let's say, very good health care. So they come to Buya, being a big city, to seek help. And been everywhere, done everything, the same story. The story of this boy is urinating blood. The urine always with blood, 11 years old. All the times, the urine is with blood. Every couple of months, the baby is anemic, the boy, is anemic, and we have to go for blood transfusion. That is the story of that boy. Nothing can help. They done everything possible. Nothing can stop that. I mean, they don't know where it is. So they do manage, the best way they can, but nothing has resolved. So this boy comes in, and I usually, usually I do something called an ultrasound. I scan the body, and you might have an idea what this problem could be, but when you scan, your views might change and your thinking might change, because you see inside the organs, you see inside the body. And when you see with a scan, you see a lot of things that can help you achieve the correct diagnosis. So, I cannot diagnose anybody without scanning them. It's right there on my right hand. I do the scanning myself, and I look. So when I looked at this boy, okay, the kidney looks okay, no problem. I mean, when you scan, you see the structure, the anatomy of the kidney looks okay. The thickness of the cortex. You see, we have the kidney, we have 2 things that we look at with ultrasound. We have the cortex, which is the most important thing. And then we have something inside that is different color from outside. We call the medulla. So now, the cortex was normal thickening, So with ultrasound, when we evaluate the kidneys, 2 things we look at. Is there any stones? How is the cortex? Is it thick enough? Because when the cortex is thick enough, it tells me that the screening, the shifting, the clearing of all the toxins from the blood is being okay. Because the kidney function in the body is to filter out anything that's not supposed to be there. Among other things, of course, which is regulating potassium, regulating sodium, and hydrogen ion. So the kidney is very important for us, very important. And you can imagine how important the kidney is if you know somebody, a relative of yours or so, that does kidney dialysis, that they have to do kidney dialysis 3 times in a week. It's a painful process, and the patient is always bound to the town where the dialysis is taking place. It's very painful. Plus, the patient is no longer the same. The health is deteriorating. So a patient that has a good kidney is definitely not like a patient that has a bad kidney that has to go into dialysis. There is a lot of complication there. The way of living, the lifestyle has totally changed. Now it's really bad. I do not wish it for anybody or hope anybody, any patient that go to kidney dialysis. And in previous sessions we explained that taking those herbal traditional medicine without knowing what you're taking is very dangerous. We have seen young people with kidney problems that has gone into dialysis 20, 30, and so it's very young age they have gone into dialysis because of what they have taken, not knowingly that this thing can cause really kidney failure. So, having said that, back to our story with that boy. The boy is urinating blood all the times. There is every time he urinates, there is blood in the urine. The boy has to do blood transfusion every couple of months because he runs anemic all the time. It makes a lot of sense. When I see blood in the urine, that means those red blood cells has broken down and the hemoglobin has been released into the urine, and that's what gives it the color. Right? So we know there is a problem. We know that boy is losing blood in the urine. So how come after all this time from one place to another, the problem is still existing? Why? Because the diagnosis has not yet been established. And that's why I say ultrasound at the time of checking the patient is very important. Now, when I look at the bladder of this patient, I see something that is abnormal. First minute, I see something that is very abnormal that I have seen before and I can easily recognize. So I asked the patient, I asked the family, has this boy been close to rivers? Does he swim in rivers or fresh water? The father says no. But the boy says yes. So what comes to my mind? Schistosoma. What comes to my mind? Schistosoma. So this is the diagnosis has already been suggested in the first 1 minute after looking at the boy bladder with an ultrasound. So the boy has been swimming in fresh water, in rivers, and schistosoma very much living in the same, in fresh water rivers or fresh water in general. So schistosoma made its way from the sole of the foot, get into his system, and this is a complication of schistosoma. Schistosoma is a microbe now. Is a microbe that made it now. Schistosoma doesn't only affect the bladder, it can affect the GI system, it can affect the lungs, it can affect a lot of things. So, but what I have seen is what? I have seen some abnormality in the bladder. Because this schistosoma, when they grow too much, they can even block the bladder. The neck of the bladder where you urinate, it can be blocked. You will not be able to urinate anymore. So that was a happy case. We could recognize immediately after just playing the ultrasound. So what would I do as a next step? We send the boy for urine analysis. Definitely we're going to see blood in the urine because that is the complaint, and looking for the schistosoma in the urine, which is very difficult really to see in the urine. We have seen something, and we suspected schistosoma, and guess what? The diagnosis was absolutely correct. So this boy suffered of what is called schistosomal glomerulonephritis. We have a kidney disease induced by the schistosoma that he gotten from swimming in fresh water. The case was identified, the medication was given, and the boy, the medication is very easy. It's a medication called praziquantel. We're not going to mention any drugs, but the medication was given. It's a very cheap medication, it's not expensive, and the problem was solved. And now the boy doesn't need to be blood transfused every 2-3 months because we killed what was causing the loss of blood. We killed the microbe that was causing the loss of blood, which it was a very easy case to recognize, but it took him a bit of time to reach to the correct diagnosis. And once the diagnosis is made, it's very easy to treat. Once I know what is wrong, the next step is very easy. We can just give small medication, repeat it every week for 4 weeks, and that's it. End of story. We give a little bit of steroids to correct the kidney, and a little bit of, I use this, is amazingly working for me and for my patients, and I have excellent results, is a gum called Arabic gum with frankincense gum mixed with few other things, okay? And everything is listed there. So it's not like you is unknown. No, everything is listed there. The most important components is Arabic gum and frankincense gum, and that seal the kidney. That seal the kidney. So leaking protein from the kidney and leaking other epithelial cells from the kidney can be easily corrected with this gum. I think I have a picture of it. It's very easy. I mean, look, it's frankincense gum with Arabic gum. That's it. That's it. And this is it. This is it. This is 7,000 for this bottle. 2 of them will correct the problem. Anybody out there with the creatinine up to 4, okay, 3, 2, anything that is above normal creatinine level for the kidney, this is it. A couple of bottles of this, and it will seal, it will heal, it will reverse the injury of the kidney immediately. But not for very high creatinine. Very high creatinine, you need to see a nephrologist for that, especially if there is high sodium or high potassium, because the kidneys is very dangerous. The kidney disease are very dangerous because it has to do with a condition called metabolic acidosis, meaning the kidney is failing to excrete the hydrogen ion. Then as a result, it being retained in the blood, causing the blood to be more acidic, and that is very deadly, very bad. So in this case, then we have to refer to a nephrologist. A nephrologist is a doctor that specializes only in kidney disease. But if the problem is not too big and creatinine up to 4, this gum here, this mix here, can bring it down to the normal value. We have very successful results with this mix, and is proven to be very effective. We have cases that been everywhere. Oh, creatinine is high, 3.5, kidney is failing. We give this, it reverses back the injury, and the kidney is now normal, and the function is absolutely normal. All the potassium, the sodium, the hydrogen ion, the chloride, everything is back normal, back to normal levels. So it's a very good thing to do, as long as the creatinine have not gone above 4. Gone above 4, that's a nephrologist there. We need to possibly go into dialysis. But if it's 3.5, 3, 4, we can bring it down to normal value only after 2 weeks of taking this gum. So this gum is really amazing. It's called Arabic gum. You can look it up online. It's called frankincense gum. You can look it up online. It has great value and has been tried. And it works amazingly. It reverses the kidney injury unbelievably fast. And it's amazing, and there's no side effect. And it works. It works very good. So we have a lot of cases that we have brought the creatinine level from 4 to 1 or 1.2 or so, which is the normal value. We're not going to take much about the time about talking about the kidney, because the kidney is a very complicated issue, and we have what is called acid base, and it's not for the audience out there to understand, but in simple English, if your creatinine is up to 4, we have a very easy way to determine the kidney function by looking at the creatinine, the creatinine value. Normal creatinine value about 1. If the creatinine value goes to 2, that means we are working with 50% capacity of the kidney right now. If it goes to 3, we are at 75 percent functionality of the kidney. If it goes to 4, we basically have no functionality of the kidney. So there is other factors to consider when we talk about the kidney. The most important factor is the potassium level in the blood. The potassium is very high, and now we talk about other issue. Patient is putting out urine, patient is not putting out urine. That's two different things that has to be discussed. But in general, we have to say that, you know, potassium is very good thing to consider when we're talking about kidney disease. Good. So let's take 1 minute break. Let's take 1 minute break, and then we'll continue to another topic.
In your health, then Dr. Soliman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Soliman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Soliman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at Mile 18 Bolifamba, and in Douala, we are located at Entrée Pilote. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Soliman.
Back. So we're going to talk about something else. We're going to discuss small about the heart. We're going to discuss a little bit about the heart. The heart is a big concern because usually it goes unrecognized till we get into the complication. Hypertension is very common. Hypertension is very common. And there are people that say, oh, well, I have hypertension, you know, my body is used to it and I can live with it. I don't need to take treatment. Is that correct? Absolutely not. But at the same time, we do not want to use drugs all the times. We do not want to use drugs all the times. In order for us to give any antihypertensive medication, before prescribing any antihypertensive medication, we have to look at the heart. We have to look at the heart. Why? Because there are 2 conditions the heart might have. We may have something called diastolic dysfunction, which means the heart is failing to relax. That's diastolic meaning relaxation. Dysfunction meaning is not functioning. That's what dysfunction means. So diastolic dysfunction meaning the heart is failing to relax. So the heart is failing to relax mean what? The heart is tense all the times. So when the heart is tense all the times, it pumps very well, but the amount of blood that is being pumped out of the heart is very small because the heart is tense. The heart is failing to relax. When the heart relaxes well, the amount of blood inside the heart will be good enough to be pumped when the heart pumps out and supply the whole body. But when we have diastolic dysfunction, meaning the heart is failing to relax, the amount of blood, assume this is the heart here, inside my 2 hands there, if the amount of blood when the heart is at diastolic dysfunction, meaning the heart is failing to relax, is smaller than usual. So when I pump I'm pumping a smaller amount of blood to the body, especially the brain. So when I pump a smaller blood amount to the brain, what will happen? The brain, let's say, is used to get this much blood. Now that my heart developed diastolic dysfunction, which is failing to relax, now I'm supplying half of the amount. So what do you think the patient will feel like? If I have almost half of the blood that's supposed to go to the brain no longer going to the brain, the patient will always complain of dizziness. I walk a distance, I get tired, fatigue all the times, especially when you do an effort. Why is that? Because the amount of blood going to the brain is now less than what it's supposed to be. And the reason for that, the heart is not pumping out enough blood. So before I write any hypertensive medication, we must look at the heart and decide, is this patient heart failing to relax, or this patient heart is overly relaxed? This is two different conditions, and the two different conditions requires two different categories of drugs. We cannot give drugs to a patient with diastolic dysfunction to a patient that have his heart all the way relaxed. Now, when we have the heart all the way relaxed and it cannot contract well, we call that systolic dysfunction. Both of the scenarios are bad, but the one that has systolic dysfunction may be a bit less severe because the heart is dilated. We can have two-chamber dilated heart, and we can have all the four chamber. The heart has four chamber, two atrium in the top and two ventricles in the bottom, right? So when we have four dilated chamber or four chamber dilating heart, that's a bad condition. This is what we call heart failure, dilated cardiomyopathy. Dilated cardiomyopathy meaning the bad heart, the four chamber are all dilated, and now we need to find medication to bring that heart back, back to normal shape. There are medications that will help this heart to come back to normal shape. How? The best thing we have to do, and basically the most important thing we have to do, is to put this heart at rest. We relax the heart. What puts a load on the heart is the blood pressure. Blood pressure meaning is like you climbing uphill with a car. So when you climb uphill with a car, this is exactly what the heart has to do. The heart is the car. The heart is the car. The car suffers when it goes uphill. Now, if I can make the road flat, the car will go much smoother and easier. That is exactly the high blood pressure. When you have high blood pressure, the car is very difficult to climb. And when we make it a straight road, the car is very easy to go forward. So that is the difference between adjusting the pressure and leaving the pressure high. So the effect, definitely, when you have high blood pressure, the effect is reflected into the heart. So the heart now has to work harder and harder and harder to meet the demands. Exactly like you're climbing uphill with a car. The car will exhaust and you will have to use a lot of horsepower and the engine will get bad. If you repeat the process day after day, that is very much the same thing. When we have high blood pressure, the heart will get bad. And when we have high blood pressure and the heart has to work every day, every hour, every second of our life to supply us blood, it is bad because now the heart will adapt by something called hypertrophy. Hypertrophy, meaning the wall of the left ventricle. We have the most important chamber in our heart is the left side, is the left ventricle. This is where the chamber that when it contracts, it pumps out blood. Hypertrophy meaning the thickening of the wall of that left ventricle become more than normal. As a result, the amount of blood inside that chamber becomes less. As a result, the amount pumped out is being less. As a result, you're not getting enough blood to do what you need to do. So that's why you get fatigue so quick, and that's why you get dizzy when you do an effort, and that's why sometimes you even can get syncope. Syncope meaning you lose consciousness and you fall. So this is the outcome, and this is the complication of something or somebody with high blood pressure that is being ignored. So as I said, we need to have the road flat like this, not like this, for the heart to be comfortable, and the heart that can work better and give us more results. What am I saying? I'm saying the following. If we have long-standing hypertension, that is high blood pressure, and that long time has already reflected negatively on the heart, that the walls of the heart now become thick, we need to give medication to relax that wall. And there is medication to relax that wall. We call it beta blockers. There is a specific beta blockers and selective beta blockers, non-specific and specific, or selective and non-selective. Anyhow, this category of drugs has proven to increase survival. We're talking about a patient that we already have decided that he has diastolic dysfunction. The heart is failing to relax. So this category of medication will be then very beneficial to the patient, that fix the heart and lower the blood pressure. So we have dual benefits here. We have two things. We have dual benefits. We already decrease the heart rate. We made the heart, accommodate more blood, so the heart is more relaxed. And when the heart is more relaxed, and as a result, it accommodates more blood, so when it ejects blood, it will eject more blood. So now more blood is going to my brain, more blood is going to the rest of my organs. I am no longer feeling tired, fatigue. I no longer have the dizziness, and I'm no longer at the risk of having syncope, which is falling unconscious, syncope. I'm no longer at the risk of having syncope. So this is, I said all this to tell you that one antihypertensive drug, if it works for one patient, is not necessarily going to work for you, because this patient might have a condition that you do not have. Because it is common that, we've seen it all the times. Hey, doc, give me a drug like this, my pressure is good and I feel much better. So what happened? His neighbor, oh, what is the name of the drug? Oh, here it is. That's the name of the drug. He goes and buys it. And then the story spread now. Now the whole community is taking the same drug because Dr. Soliman prescribed it and it's good medication and it works fine. So the whole neighborhood now is taking the same drug. That is wrong, because you don't know what he has. His diagnosis might not be yours. Listen to me carefully. If I give somebody a beta blocker because he has LVH or left ventricular hypertrophy, or in other words, the heart is failing to relax, and it works for him because this is his condition. His heart is failing to relax, and this condition, this drug here, works for him beautifully. What if you have the opposite condition, meaning the heart is dilated, and now I give you this drug and I make the heart more dilated? What's going to happen? That's a disaster. That's a disaster, right? So when I give somebody a drug, you guys don't share it out there. Oh, doctor, give me this drug and it's working fine. My pressure is good. I feel good. You might not have the same condition as your neighbor or your brother or your friend, because they meet in the meeting every Sunday or whatever. And I mean, this is life stories. This is what I've been told from my patients. The doctor gave me this drug, is good, take it. So he thinks he's doing him a great favor. He thinks, he did me a great favor. I don't have to go and I don't have to, lose money, and I don't have to do this and I don't have to do that. Here is the drug ready. Because you have hypertension, it worked for me, it should be working for you. Wrong. You're killing your brother, but you don't know. Because your brother might have a totally different condition that requires the opposite drug. I mean, the opposite effect of another drug, not the same. So when I give somebody some medication, it's not necessarily that it's working for everybody, because different people have different conditions. So when we talk about, bottom line is, when I talk about hypertension, I am talking about, evaluation that has to be done by a professional doctor. an evaluation that has to look at the heart, see what condition the heart has, and an evaluation whereby we can evaluate everything correct. What if the blood pressure coming from a problem in the kidney? We have a condition called CKD, chronic kidney disease. Chronic kidney disease can raise my pressure by a different mechanism we're not going to discuss now because it's a bit complicated and it's all medical terminology. We're not going to get into that now. But if you have a kidney problem, you can have a rise in blood pressure. Right? We can have a rise in blood pressure. So what is the cause for the blood pressure is the kidney. Fix the kidney, the pressure goes away. Right? Fix the kidney, the pressure goes away. Now, there are different kinds, different causes of blood pressure. The most common of which is essential. Essential meaning we don't know what causes it, but it's there. Because the kidney is good. Another cause for the hypertension is probably the thyroid gland. So we do the thyroid is good. We do the kidney is good. We do the adrenal gland, the adrenal gland is good. I don't see any obvious reason for this guy to have hypertension, so we call it what? Essential, meaning we don't know why, but it's there. Now, we have patients that always maintain high blood pressure, and this is maybe, most likely, is a genetic cause. Now, this is what we call familial hypertension. Then if you check the grandmother, probably has it. If you check the mother, who probably had it. The ancestor probably have it. So it runs in the family. Like exactly familial hyperlipidemia, too much fat in the blood. And I don't eat any fat, doc, but the fat in the blood is high. Why is that? Because it runs in the family, genetic causes. So this is things that we should be looking out for. Now, do not take high blood pressure lightly, because high blood pressure can cause a stroke. And you're not immune to stroke. Nobody is immune to stroke. If you have high blood pressure, that's a high risk to blow a capillary in the brain. And when you blow a capillary in the brain, that's hemorrhage. Okay? That's hemorrhage. And that can be very, very deadly. And you could have easily prevented that by a small tablet that you take every morning. So, high blood pressure is not to be taken lightly. Now, high blood pressure has to be confirmed. And not everybody with high blood pressure in one setting, I call them, okay, come, I give you this medication and I do this and I do this. No, it has to be confirmed, because in life we'll go through stress. In life we'll go through stress. And stress creates high blood pressure. So it is advisable then, if I take my blood pressure today, okay, it's high. Then I skip a day, I go tomorrow, it's high. I skip a day, I go the next day, it's high. So I did 3 different occasions, and the blood pressure is high. And I know I'm not stressed. There is nothing. It's everyday life, you know, maybe my life is stressful a little bit, but now I have 3 different occasions that the blood pressure is high. Then we need to go for evaluation. Evaluation what? What does evaluation mean? I need to know the cause. Is it because of a bad kidney? Is it because of a bad thyroid? Is it because of a bad adrenal or hormones from the adrenals that is out of whack, out of limit? We need to find out. And if it's none of the above, then it's essential hypertension. Then we have to treat, we have to lower. And before we treat, we have to look at the heart. Very, very important. When we treat hypertension, we have to look at the heart. What is the condition of the heart? Is the heart dilated, or the heart is constricted and, you know, thick and fat, you know, like the walls are too thick? We have to find out. Because with one medication, I can treat, like I said, I can treat both conditions, the hypertension, the high blood pressure, and the condition of the heart. I think that is, you know, very informative and very advisable, that you guys out there, if you feel your blood pressure is high, do not take it light. Do not take it light. We're going to talk about the heart also for a few more minutes, but let's take please another 1-minute break.
Are you facing challenges in your health? Then Dr. Soliman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Soliman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Soliman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at mile 18 Bulifamba, and in Douala, we are located at Entre Pilor. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Soliman.
Welcome back. So we discussed about the heart. If you have high blood pressure, please do not take it lightly. And please do not take a medication that your friend is taking, because your condition might not be the same as your friend. So that is the second advice. There is something called aspirin, baby aspirin, 81 milligram. Patients above 4 years old, they should, take one. That's the recommendation. Take one aspirin every morning. But this is not for everybody. Before I give a drug, I have to see, what if you have thin blood? Thin blood meaning you have a problem with coagulation. Coagulation meaning clotting. What if your blood doesn't clot well? What if you have a problem with bleeding? You have a bleeding disorder. Can I give aspirin? So again, even that small aspirin, not everybody can take. We have to know that you are the right candidate for it. We have to know that you are the right patient for it. So just to give you an example, if you have a clotting problem, we have to think very hard about giving you any aspirin, because aspirin will increase the thing out of the blood, and you'll even have you will bleed more. So bottom line, why I'm giving you all those examples? I'm giving you all those examples to be sure. Don't put nothing in your mouth unless you're 100% sure what you're putting in your mouth and for what, and you've been correctly evaluated. So you avoid things that is not really unneeded. You can avoid, you can prevent a lot of things by just being careful out there and take the advice. Look at things before you put in your mouth. Evaluate everything correctly before you decide to do one thing or another. Now, let's talk briefly about stroke in 2 minutes. Why would a patient have a stroke? You absolutely today, you can walk today, you can run today, and tomorrow you cannot move your right side. You cannot move your left side. You can no longer talk. Your mouth is dropping from one side like that. You cannot even speak. What happened? Stroke. Yesterday I was fine. Today I have a stroke. Yes, we see it every day. So what happened? That's somebody who ignored his blood pressure, high blood pressure. So it blew a capillary in the brain. When we have a stroke, we're talking about the brain. We're talking about the brain. That is, you blow a capillary in the right side, you have paralysis in the left side. You blow a capillary in the left side, you have a paralysis in the opposite side. Now, this is the most common area. So if the area happened to be a speech area in the brain, that is the area responsible for talking, and you blow a capillary there, you will not be able to talk. If it happened in the motor area responsible for moving your hand or moving your leg, you will not be able to move your hand, you will not be able to move your leg. What happened? You blow a capillary. Why? Because you ignored high blood pressure. So I'm not saying that wait till you have the problem and then fix it. I'm saying it's very easy and it's very free to walk anywhere. A lot of health centers and clinics offer free hypertension. It doesn't cost you anything. Check your pressure. If you're okay, that's good. I advise everybody for normal and regular checkups, especially the pressure and sugar. Sugar is another disaster that we have to talk about. Maybe in another session we're talking about diabetes and the complication of diabetes. And even young people today, they get diabetes. Okay, so it's not only old age. No, everybody is at risk. Now, stroke is a disaster. Stroke is a disaster, and believe me, it can happen when you don't even expect it. There is a new treatment for stroke that I've been using it, and it's a very good treatment, and it requires you to be on the treatment for 3 to 9 months. But believe me, those who couldn't move the hand, now they can move the hand. They can move the hand, okay, and they can. It's never like before, but they are much better. Before they cannot move the hand, now they move the hand. So it's an improvement. Thank you very much. This is the end of my time. I thank you all and have a nice weekend. And I will see you next Saturday, 9 o'clock. You've been with Dr. Soliman, Your Health Today. Thank you very much. We'll see you next week, Saturday, 9 o'clock. Be there. Thank you.